Begin with roll call. I am here, Kelly,
I'm here.
and at this time, I believe we only have two members, right? Okay, so we will dispense with that. And Kelly, can I get approval for minutes from December 9, 2025, please?
I'll move to approve.
Um, so now my brain, I had too much excitement. What do
It's
we
okay.
do?
It's okay. Let's vote.
Okay, so I vote yes.
I vote yes as well.
Okay, so that is dispensed with. And item number four is the affiliation agreement with Tacoma Community College for Training, Fire Department. Chief, can you please go ahead, please?
Yeah, absolutely. I'll share my screen here. Can everybody see that? Perfect. This will be real quick. What you have before you is an affiliation agreement with the Tacoma Community College for basically allowing riders on our medic units in to come ride here at Tumwater Fire Department. So, you know, there, way too bad. So what this affiliation agreement does is it provides clinical and learning experiences for any of the people that are going through the paramedic program at Tacoma Community College or TCC. So roughly, it's about a year-long program when you include all of the prerequisites and all those courses. But the program really starts up about September and goes through June. Uh, they need they work in kind of semesters, quarters, if you will. The first one, there's a handful of rides that they go out to the sites to do ride-alongs, and then really starting about this time of year through June, they're doing about 27 shifts at local fire departments, private ambulance companies to get their experience. So this agreement, we actually go back all the way back into the 1990s, partnering with TCC to allow paramedics to get their training and see real patients when they're going out. Uh, Another thing that's a benefit to this agreement is it's very beneficial to our paramedics and our EMTs as well, because I can speak from my own experience of having riders. They really test you, which is good, and knocks off some of those cobwebs, if you will, after you've been doing the job for a little while. So it is very beneficial for our paramedics and EMTs. It also kind of is a career builder, if you will, because they can get the opportunity to teach and educate. Uh, it is also a great recruiting tool for our department. To be honest, I will say your two fire chiefs, Chief Hurley and myself, both came from TCC and both rode along. And there's a number of us that are working for Tumwater that have gone through this program. So we do utilize this as a semi-job interview and along with trying to recruit paramedics because some of you may be aware, but uh, it is very hard to find paramedics nowadays, similar to like other professions like nursing and those fields. So this actually is a very beneficial way to uh, let them see our fire department, see our culture, see the city, and recruit them. One thing that we do partner with TCC is to allow our current firefighters, firefighter EMTs, to get into the program. We actually currently have a firefighter, Jennifer Lindstrom, that is going through the paramedic program currently. And so when she comes back, graduates from the program in June, we'll be able to utilize her as a paramedic, which is awesome because it's once again it is getting tough out there to find qualified applicants for paramedic. The other big one that I think everybody likes is there is no budgetary impact to the department. Uh, this is just an affiliation agreement. We don't pay overtime. You know, our paramedic lieutenants and our senior paramedics are the ones that are mentoring and being the preceptors for these potential students. And with that, there's the recommended action. It's a lot to say, so I'm not going to say it. But yeah, just looking for approval to send this to consent calendar, hopefully next council meeting. And happy to answer any questions.
Thank you, Chief. I do not have any questions. Does anybody have a question?
I don't have any questions, but I think that this is just such a great partnership, and how lucky are both TCC and Tumwater Fire to be able to have this. So, I mean, granted, depending on I-5, it could be a quick trip or not, but like so close. And so I'm just really excited. So I am ready to make a motion. Okay. I recommend that we place the affiliation agreement with the Tacoma Community College on the January 20th, 2026 City Council consent calendar with a recommendation to approve and authorize the mayor to sign.
So move. So call for the vote. I vote yes.
I vote yes.
Okay, congratulations, Chief. That will be moved to the consideration calendar at Food Council meeting. Thank you very much.
Yeah, thank you.
Thank
You have a
you.
good day. Item number 5 is the challenges opportunity for unhoused individual in Tumwater, City Fire Department.
Yeah, and I'll just kind of kick it off, and I'm going to punt it over to Erica. So Erica helps run our Tumwater Mobile Outreach team. So yeah, I'll pass it over to Erica for this presentation.
Thank you. And I was hoping that someone could let in our Executive Director, Joe Avalos. It looks like he was added as an attendee instead of a panelist.
I will work on that.
Okay,
Great, because he has our PowerPoint.
sorry about that.
Not a problem.
And just for a little context, when Joe jumps on, but just a reminder, this program has started. We actually fired it up back in October, and they're doing great work for the citizens. I know we meet regularly with both police and fire and the MOT, our mobile outreach team. So doing good work. So hopefully Joe can jump on here in a sec and share his presentation.
See.
I apologize. I'm having some technical difficulty. For some reason, it's not letting me invite somebody. I'll keep working on it. Hold on.
Okay.
Mr. Avalos is raising his hand.
Hi all. Would it be helpful if I signed off and try to sign back on again? If you can hear me.
You're on, Joe.
We can hear you.
Okay. It
Are
doesn't
you
look
able to
access.
share though?
It doesn't look like I have the ability to share the PowerPoint um, or make any. Erica, maybe I'll forward that over to you or Layla. Happy to just to join from here if
You're muted, Erica. Yep, I will work on sharing right now.
I don't think there's a way for me to add my camera. I'm looking to see audio controls, but in any case, you all have seen me before, so so I'll,
Are you able to see the PowerPoint?
Yes.
yes, we see it in the Word.
Yeah.
Yep. Okay.
Okay.
All right. Well, thank you, everyone. Sorry for the technical difficulties there. My name's Joe Avalos. I'm the executive director here at Olympic Health and Recovery Services. And as Chief Crimmins said, Chief Hurley actually reached out to me a few months ago asking if we would discuss uh, what challenges or opportunities there were with the hospice population specific to the Tumwater region and in Thurston County. And so today we're actually going to really focus on that. OHRS, aside from the great work that we're doing with the Tumwater Mott team, a lot of the work that we're doing with our hospice population is through our other programs. And so we'll talk a little bit about those. And I have brought Erica and Layla, some of our leadership team, to really speak to that more in depth since they are really closer to that work. Erica and Layla, just I don't know if you guys could introduce yourselves and a little bit about your background. So I don't know that you've presented to this committee before.
No, my name is Erica Dennehy. I'm the clinical director at Olympic Health and Recovery Services. So I oversee our crisis services. I oversee our hospital diversion program and our jail diversion programs. Layla?
Hi, good morning. My name is Layla Cardenas. I supervise the HOST program. It's Homeless Outreach Stabilization and Transition. We'll talk more about the program and how we function in the community later on in the slides.
Thank you both. So just a quick reminder, OHRS, we are a licensed behavioral health agency, primarily serving the Thurston and Mason counties. We were established in 2018 at the direction of our Thurston Mason Behavioral Health Governing Board to really focus on outreach programs in 3 specific areas. That's crisis, jail diversion, and hospital. And we are governmental. So I report to Thurston County Commissioners Mejia, and Rachel Grant, and Mason County Commissioner Pat Tarswell. So we have a lot of benefits of being part of a governmental entity. And our mission is really just providing that safety net for our most vulnerable populations in our region that are going through behavioral health crisis and providing them connections to supports in our region. So next slide. I don't know that I presented this slide before, but these are all of the programs that OHRS offers. 3 main areas, all of them work together and all of them are outward facing. So I won't go through all of them specifically, but just a couple highlights. In our crisis services department, this is where the Tumwater Mobile Outreach Team sits, along with several other crisis programs. We have the 24/7 Regional Crisis Hotline. We were just awarded the 4th 988 hub for Washington State. That happened just a couple weeks ago, and so we'll talk more about that hopefully in the future, but that's upcoming. And then we have several embedded law enforcement alternative response teams with several jurisdictions throughout Thurston County and in Mason County as well. And then, of course, we have the designated crisis responders, which I spoke about a little bit last time. On the jail diversion department, this is all helping individuals who are either incarcerated in Thurston County Correctional Facility or Mason County Jail, or helping them transition out of those facilities. And then finally, in the hospital diversion program, this is where the host team resides. This is all about folks helping folks transition out of state psychiatric facilities or community-based psychiatric facilities, as well as preventing folks from going to hospitals. And this is where our host team goes forward. All right. Thanks, Erica. Next slide. And I think I'll hand this one over to you. Thank you.
Okay. I'm just going to jump right in with some challenges related to the unhoused population that our organization has faced. So, specifically in Tumwater, one of the challenges is simply finding people. In other areas of Thurston County, we find encampments are more congregated with 10 to 50 people residing in one area, but encampments in Tumwater tend to be dispersed and they change frequently. So our team spends significant time locating individuals before we can even attempt to engage them. And as we know, a lot of that mobility is often driven by encampment switch, which have been happening over the last few years. So when people have to move quickly, any progress or stability or follow-up appointments tends to get disrupted with those sweeps. And even once we connect, progress takes time. Layla can attest to that building trust sometimes takes 5, 10, 15 outreach contacts before someone is ready to accept help. And some sites, encampment sites, aren't receptive at all, especially in less populated areas where there's distrust of more formal systems. We also see that safety and security are real concerns for the unhoused population. Many people are reluctant to leave their tents because they worry that their belongings are going to get stolen or removed while they're gone. And that fear keeps them from getting medical care or behavioral health services or connecting with any other social service providers or even housing appointments. And we've also noticed that access barriers adds another layer to this. So most services are concentrated in the Olympia area. And even when someone is near a bus line, coordinating schedules, multiple trips can also be pretty major barrier. And many people don't know where they can go for help or even if they qualify for services. And then finally, obstacles within the housing options. The housing market is tight. We all know this. And even with vouchers or rental subsidies, which our organization provides, things like criminal history or prior evictions or a lack of rental history can close those doors. So while resources may exist, the pathway to actually get into housing is fairly steep for this population. I'm not going to go very much in the weeds on this, but when we're talking about the unhoused population, I just wanted to mention the point in time homeless count, as it provides a lot of good information and kind of a snapshot of the trajectory of where we are going. So each year, Thurston County takes part in the statewide point in time count. And this snapshot is really helping us understand how many people are experiencing homelessness and what are some of the contributing factors. So you can see that in 2024, the count identified 952 people that were experiencing homelessness in Thurston County. And this is for sheltered, transitional, and unsheltered individuals. While it's still lower than what we saw in 2020, we've had a pretty significant jump since 2023. So we're seeing the numbers trend up again. And about 35% of those people that are counted as unsheltered. So that means they're staying in places that aren't meant for individuals to live. So this is cars and tents and doorways and sidewalks, abandoned buildings, or just on the street. But the reality is that this number is likely higher. Some people don't consent to being surveyed during this time. Other people are staying with friends or might be in hospital or jails during this count. So even though this is a high number, I anticipate that it is higher than what we're seeing. In the Tumwater area over the last 3 months, just our community-based crisis team that's embedded with Tumwater Fire, on average, we're seeing between 8 to 11 unhoused individuals each month. And the services that we provide overall, 30% is going to this population. So it's pretty significant. Here's some of the ways that OHRS is responding and how our work not only aligns with best practices, but also Thurston County's priorities for working with the homeless population. First and foremost is we start with direct outreach. Our crisis response teams, like our host team, which Layla will talk about a little bit later, homeless outreach, stabilization, and transition, we meet people where they are at, including encampments. It's a multidisciplinary team by design, so we can address both the physical and behavioral health needs, even when someone isn't ready to use traditional clinic-based brick-and-mortar services. The services come to them until they're ready, and we can connect them with longer-term, more traditional services. We also provide practical resources to engage individuals. Hygiene supplies is a big one that people are requesting. We utilize certified peer support specialists. So we integrate peers with lived experience. This does quite a few things. One, it builds trust, and also it helps model hope and demonstrate that recovery and stable housing is possible and achievable. We rely a lot also on warm handoffs. So it's difficult at times to navigate resources. So we have teams that will accompany people to those resources. We provide transportation there. This helps reduce a lot of the no-shows at more traditional brick and mortar type services, helps us build trust. And then if we continue that engagement and that trust and we keep showing up, the hope and what we have seen is that people are more receptive to the services that are offered. We also have programs such as law enforcement assisted diversion, which this program really focuses on kind of underlying issues that drive law enforcement involvement. So when we're able to connect people to shelters and basic needs and ongoing recovery supports and substance use, the hope is that they won't have as much frequent contact with law enforcement. We can divert some of that. On the housing, we provide short and long-term rental subsidies for priority groups, including people that are discharging from behavioral health facilities. We offer forensic housing, reentry services like Joe was discussing with our jail programs, and recovery programs for individuals that are involved with the justice system. We work really closely with coordinated entry and local social service providers to kind of keep those referral moving and continue to provide updates for clients so that they know where they're at in the system, that they're not getting lost between the cracks, that someone is there advocating for them and continuing to show up. And we are actively partnering with landlords to open units for people who might otherwise be screened out due to criminal history or prior evictions or maybe limited rental history. So even when subsidies are in place, it's difficult to find appropriate housing for those individuals. I also wanted to take a moment to just kind of highlight the work that the community-based crisis team, TMOT team that's embedded with FIRE is doing, specifically with this population. Again, it's been going since October. And even though I've discussed kind of several barriers in working with the unhoused population, we've had some pretty tangible successes. In one case, we completed an outreach to an individual that was unhoused. We were able to provide transportation and get coordination to get them into a local shelter and then enroll them in services, and they are still there. In another case, we helped a person that was transient from Pierce County and had some pretty significant behavioral health symptoms. They didn't know how they ended up in Tumwater. So we helped navigate them back to Pierce County, identify shelter options for them, coordinate transportation, and connect them with local resources in Pierce County for ongoing care. And then last individual is someone with pretty significant uncontrolled behavioral health symptoms, which was directly impacting their housing stability. So our team was able to transport them to South Sound Behavioral Hospital for voluntary admission to address some of these issues that were contributing to homelessness. And South Sound works very closely with our hospital diversion team for referral. So they refer individuals to us. This allows us to engage with people even prior to discharge from inpatient or substance use disorder facilities and arrange for transitional housing or emergency housing or provide rental subsidies. So post-hospitalization, they do not have to return to homelessness, which will help with the stability and sobriety. Those are just a few successes that we've seen in the last 90 days. I'm going to turn it over to Layla to talk a little bit about our host team and the work that they've been doing.
All right. So, in 2022, HCA recognized that there were 6 regions with the highest number of unsheltered individuals. We were identified as one of those regions, and so we were able to launch the HOST program. And HOST is really awesome. It's different in the way that it is a multidisciplinary team, so every person on the team has a different expertise that they bring to the table so that we can kind of provide a whole person approach to individuals. So right now we have a mental health provider, a substance use provider, an intensive case manager, a peer specialist, and then we partner with Providence for a psychiatric nurse practitioner and a nurse. So when we go to see an individual, we can provide all sorts of services that they might be needing. It's usually maybe a little SUD and a little medical, but we're able to figure out what that person needs and provide that in real time. The people that we're serving are like the very, like if you have a pyramid of needs, I don't know if you know Maslow's hierarchy of needs, maybe not, but the very basic like safety, security. These individuals, they're worried about where they're going to get their food. Like they have a weeping wound that's preventing them from walking and getting their basic needs met. These very basic needs are what they really need in order to be able to function at a higher level. So those are the services that we're kind of starting with to help them. These individuals also are people with severe and persistent mental illness and substance use issues. One of the requirements for our program is a current or history of substance use disorder, and most times that is co-occurring with mental illness as well. So we are helping people manage those symptoms while also getting them the care that they need. We meet individuals wherever they are. We don't have any people come into the office. It's all out in the community, wherever they are, whether that's, in a homeless encampment, on a corner where they're flying a sign, or at the medically assisted treatment clinic, at, Union Gospel Mission, wherever they're at, we come to the corners of the counties. We serve both Thurston and Mason counties. So if any of you guys identified an individual or a location where you see people coming together, or it looks like it might be developing a camp, anyone's welcome to reach out and let us know, hey, I see all these people over here. Can you guys check that out? And we will go out and provide or offer services. We have some engagement funds available to assist individuals with various items. We have, provide tents, sleeping bags, and naloxone, which is for overdose response. We assist with medication copays if they need it and have a spend down and aren't able to get those medications. We can assist people with all sorts of like dentures if they need connection with that, vision, just any basic needs that you can think of. We're assisting individuals with those. We're connecting them, taking them and connecting them to services with Department of Social and Health Services, getting people connected with employment services, education services, any self-identified goals that they have in order to make it to the next level of care that they can reach. that's what we're there to help them do. Eligibility for our program is 18 and older, unhoused or at imminent risk of houselessness. This can also look like homes without sufficient running water or electricity. And then current or history of substance use disorder, co-occurring disorders, and they are unable or unwilling to access traditional services. So individuals who might not be able to go to those brick and mortar services, like Erica mentioned, due to different barriers, people not wanting to leave their items, people being unwell, so not being able to utilize public transportation, or in Tumwater's case, maybe being off of the bus line, so they don't have access to getting to places where they can provide services. We go to them, so that takes that barrier away. I think that's it. I don't know if anyone has any questions about the host program.
Thanks very much, Layla. I think we kept it right to the 30-minute mark. As Layla and Erica said, we're happy to take any questions from folks.
I do have a question, Joe.
Yes, sir.
So, shortly before the holidays, I did interviews with some unhoused people in downtown Olympia for a project that I'm working on. And my summation from that from those interviews, I interview sample size for was that when they go to seek treatment, they do that because they wanted to get off the street for a period in time. And then once they receive that treatment, they are back onto the street. So now, how do you make sure that they are not in and out of services that they are actually receiving, say, for example, stable services, medical, and from there to housing, and then permanency, and then they are tracked to make sure that they stay in one particular area. How do we do that?
That's a great question, and I'll start, and then Erica and Layla, please feel free to jump in if you can. I think when you're talking about folks who are in treatment, if you're meaning an inpatient setting, that is where programs like our HARPS teams, that's a Housing and Recovery through Peer Services, will attempt to engage with individuals and be that bridge back to the community. So with the HARPS program, we can offer dedicated peer support to help with that transition, as well as a limited stipend that can help with things like basic essentials, or even with rental assistance for a very short period of time. And so the team typically has a pretty full caseload. I think, Erica, if I remember correctly.
Yeah.
But they're always out engaging with folks and trying to connect them to services. As Erica mentioned, housing is very tough to come by, even transitional or limited housing. So we are working with as many landlords that we can in the region, with apartments, with hotels, and then really just trying to maintain that contact throughout to help ensure folks will continue with whatever is recommended after an inpatient stay. All of that said, it is still voluntary. So if individuals, decide that they want to pass on our service, they certainly can do that. We will continue to engage as much as we can, but there certainly are sometimes barriers there to accepting that help. And I don't know, Erica or Layla, if you'd add anything to that.
Yeah, I second that. And also the familiar faces within the social service organizations. I mentioned that sometimes we might engage with someone 5, 10, 15 times before they're recognizing us, before they're willing to accept services. So yes, like Joe said, it is voluntary. Yes, we connect with hospitals in the area to try and bridge that transition and try and build rapport, especially while people are more stable in the hospital. But it's voluntary. And so we do the best we can to continue to show up and continue to be responsive to the community. Layla, do you want to add anything to that?
Yeah, I was just reflecting on like what do we see? And I think that, I'm going to go back to we are assisting people with severe and persistent mental illness and substance use issues. And so um housing is difficult for people without those things right now. Like, it is difficult, it is expensive and right now competitive. So we have these short-term subsidies and each level of help has its own barriers. And so it's impossible for them to do it on their own. And then even with case management, it's like, okay, so in order to get this subsidy, they have to go to inpatient treatment. So a lot of them don't want to go to inpatient treatment for various reasons. They don't want to feel the withdrawal from opiate substances is incredibly painful. So there's fear. There's also like people have developed these spots in camps or wherever, and they don't have anywhere to put any of their belongings. So they're going to lose all of those belongings when they go to inpatient. And say they're like, okay, I'm done, I'm ready, I'm going to go to inpatient treatment. So then they go to inpatient treatment and they get connected. So they have to make sure that that their provider in inpatient treatment refers them to a HARPS program. So if they're not connected, hopefully they're connected to like one of our services or something prior to, because then we can prompt the inpatient treatment to create that referral. But if they don't, then there's no prompt happening. So maybe they'll be referred, maybe not. But say they get referred to HARPS. Perfect. They get referred to HARPS. This is a short-term subsidy. So then they need to find them a place. That's another barrier. Say they find them a place and we're like, sweet, we got a place. That is short-term subsidy. And so they have to find a way to sustain that place on their own. And that means that they need some sort of income. Now, reminder, we're talking about people with severe and persistent mental illness. And so they don't just get jobs as easily as someone who presents how society wants people to present. So they're looking for a job, and that might take a really long time to find that place that works for them. Or say that their mental illness or disability, because we have a lot of people with physical disabilities as well, prevent them from working. So then we need to go through the process of getting Social Security, and that is a long process where the majority of people get why am I struggling with the word? Denied. They get denied at first, and so then they have to appeal. It is it is an incredible process that we are asking people with severe and persistent mental illness to go through, which is difficult even with case managers on board. So we do our team does amazing work, and I see them beat the odds every day, and I'm stunned by their work. I'm like, you got someone in somewhere, like this is amazing. It's like a miracle. We have a bell in the office because we're like, dang it, like this is amazing. There are some barriers for these individuals that make it incredibly difficult for them to, it's not like what I always say, it's not just that pick up your bootstraps and get a job. It's not that easy. So sorry, that was long-winded.
Thank you very much. A follow-up question is, you said that in Tumwater, because of the dispersion of the unhoused population, it is difficult to find them. And that I can correlate that. Uh,
You muted yourself, Peter.
Sorry, I'm talking into the wind here. So in early December, while I was doing this project of mine and doing the interview of the unhoused population, on my way home, I discovered an unhoused, two of them pitched a tent at the back of DOH offices here in Tumwater, main Thoroughfare. So came out of the car, I went to go talk to them and see what services that they might need to get them out of the cold, because he was very cold at that point in time. Now, I didn't call Tumwater because my daughter who was with me said, Dad, you just can let them spend let them spend the holidays there. So now my question is, or rather a statement. Yes, I agree that it is difficult to find them because they're dispersed. But if you're really going to be looking and finding them, you're going to be looking in the woods. So, for example, Pioneer Park, around that area, there's quite a few of them. And then at the back of DOH offices here in Tumwater Boulevard, I believe the crossroads is Nikolai or something to that effect, or Bunnywood. There's a little strip of bush out there that the two people that have pitched a blue tent in. And then if you go down 99W, I believe shortly before the preserve around that area, I saw some tents also. You just have to know where to go find them. So while we don't have an influx of homelessness, we do have them here and there. So maybe you need to change your tactics of how you find them. And thank you for your presentation.
Absolutely. And my email is on the PowerPoint, and anyone is welcome to email me and let me know of locations because they change frequently. And so
Thank you.
anytime you want to reach out and give us a new location, we're happy to outreach any location that you guys provide. There are certain locations that are not open to outreach. And so the team is more hesitant for safety reasons to approach those places, but we're always willing to provide or engage services anywhere that you identify.
Thank you for additional information. Thank you. So on that note, do we have any question or any statement?
Yeah, I would like to say something. Thank you.
Okay.
Thank you so much for this presentation. Our community members who are unhoused, it's a complex issue, and so I really appreciate you saying things like it's not as easy as saying pull up your bootstraps and go get a job and find housing, because if it was that easy, we wouldn't have the crisis that we're in now. So I really appreciate all the work that's happening. I really appreciate after 90 days hearing even just a handful of good news stories, because it shows that these services are very needed, and even in Tumwater where our population is dispersed, but it is there. They're just not as visible as in Olympia and Lacey, just because of how our city is structured. So I really appreciate all this work, and I hope to hear more updates as it continues. And also, I'm gonna save your emails and be reaching out because I want to be part of the solution. So thank you again for taking some time this morning to educate us.
Absolutely. Please feel free to reach out anytime. We're happy to come back and chat about how things are going. Thank you very much.
So on that note, Joe and crew, thank you for coming this morning. We will move to item number 6, additional items. I don't have any additional item.
I just want to again congratulate Tumwater Fire on the push-in event that both you and I, Peter, got to attend last week, and Acting Chief Keyless was there, so police was supporting fire. It was a really good day, and so congratulations on the new medic unit.
Yeah, thank you. Thank you, all council members and everybody that showed up. Yeah, it was a great event, well attended. So yeah, thank you.
So Chief, we were told that coffee and donuts were going to be available, but we didn't see that. So that was the only spoiler. So,
There were cookies and cupcakes.
well, I didn't see those. So. Well, on that note, Chief Krilis, Chief Crimmins, and all those in attendance, thank you very, very much for our first meeting of the year, and hopefully we'll see you going down the remaining part of the year. You guys have a great day. We are joined at what time is it?
8:45.
8:45. You guys have a good day.
Bye. Thank
Bye-bye.
you.